Okay, and now we're going to start. Good morning, good afternoon, and welcome to Neuro Challenge Foundation for Parkinson's. We're so happy that you're here today to be part of this webinar. It is called Step Smarter with NUSHU, and you're going to hear from Erica DeMarch today. And what I'd like to do before we get started and before I introduce her is let you know a little bit about Neuro Challenge in case you're just coming in and finding us for the first time and you don't know who we are. We are a nonprofit organization that serves the Parkinson's community. That's people with Parkinson's as well as their care partners. And we primarily exist in the southwest region of Florida. However, since the pandemic, like everybody else, we pivoted and went virtual and we learned how to reach people in a much wider audience. So now we serve people from all over the world. And so we're really happy to be able to bring this information to you. This is a great new technology that you're going to want to hear about. And a little bit of housekeeping. If you have any questions for Erica during her presentation, what I want to urge you to do is go to the bottom of your Zoom screen and find the Q&A bubble. It's got a question mark on it. Find that and type your question in. We can't see your smiling faces out there. This is a webinar format, so we aren't seeing you in boxes and we can't see you raise your hand. So if you will do that for me, that would be really helpful. Type the questions in. We will answer them at the end. All right. Without further ado, let me tell you a little bit about Erica. She is a physical therapist, educator, and innovator with over 20 years of experience in neurological rehabilitation, balance, and motor learning with a special focus on Parkinson's disease. Inspired daily by the determination of her clients, she is passionate about translating science into practical, confidence-building solutions that improve everyday function. She is the creator of the Balance Matters system, a clinical designed balance training and assessment approach used to improve stability, sensory integration, and fall resilience, as well as the Balance Up program, which promotes balance and movement across the lifespan through education and play. Erica has presented internationally and contributed to evidence-based rehabilitation programs in neurological care. She currently serves as the U.S. lead for clinical partnerships at Magnes, supporting the adoption of NUSHU and NUSHU X to bring real-world gait and balance insights to people living with Parkinson's disease. It is such a pleasure to have you. I was trained in Balance Matters once a long time ago, so it's incredible to meet you today.
Great.
Yeah, yeah. So, all right, without further ado, I'm going to pass it over to Erica so she can get into this topic.
So thank you again for having me. I'm excited to present today and really talk about balance. Um, yes, in a webinar format, I'm going to try to make you as much as possible interactive. That's how I usually lecture. So in your chair, wherever you're sitting, you're going to be doing some exercises with me. Let me know at the end if there is some questions, but I think it is important to start to feel your movements a little bit. Um, so today, I really, besides introducing on NUSHU, I want to explain a little bit more about gait and cueing, really educate you on cueing, and really start energizing the sensory systems. And you're going to understand why that is important as we talk more about the technology. And lastly, I really want to empower you with this knowledge. There is so much more research that is happening that I hope excites you. And at the end, to see if you're excited to go take a walk after this talk. So let's see. First, I'm going to do one little exercise. We'll see. This was really fun. I was in Kansas City last weekend and we did this. So I want everyone to kind of prime their systems to wake up a little bit. And you're going to do 3 movements with me. So I'm going to back up a little bit because this is important for you to kind of wake up. I don't know where everybody is and what time it is, but I want everyone to put their arms up and say, I can. All right, so I can, and I know I can't hear you in a big group. We can hear everyone say, I can. Then you're going to put your hands on your hips, almost like you're super confident, I will. and then I must. Okay, so I can improve my walking, right? So this is really important. Everyone's walking can improve. We just need to give them the right input. Um, Once you understand the rationale, then it's easier for you to be able to make those changes. But then once after you understand, you have to actually exercise, right? So I want everyone to say, I can, I will, I must. All right, one more time. I can, I will, I must. All right, and then I might quiz everybody. See, this is a little to see if you guys remember those three movements. All right, so we're gonna do a quick awareness exercise before we move. So into the lecture. I want everybody to march in place to keep safety. We're just going to do it in sitting. And I just want you to march in place here. And I want you to start thinking about what are you paying attention to? All right. So are you paying attention to the lift of your leg, how high you're lifting up your leg? Are you paying attention to the position of your foot when it goes down? Are you paying attention to the rhythm, having a similar beat? Are you paying attention to the speed of your movement? How does that all change how you move, right? So now I want you to, does anyone exercise to music, right? Or movement? There's different cues that can help us improve that movement. So I want everyone still marching in place. Kind of see, how fast you're moving. Are you moving at your comfort pace? Are you moving a little faster? And then what happens? This song was designed by a music therapist friend of mine. She used a harpsichord, if anyone knows what that is. Um, so I want you to hear this song. And we're going to talk about how different feedback mechanisms help us improve whatever movement that you would want, right? We can do one more time. I want everyone marching one more time and then see what happens when you did those three movements. So there's a lot of movements when you do dual task, your movement quality might change. So if you're marching, do you remember those three movements I just said? So I can, I will, I must. Did you keep that same rhythm? Did you go faster? Did you go smaller? All of that is increasing awareness of your movement patterns. So let's talk about walking. If you in the chat, some people are more comfortable, but if you want to even put in the chat to answer the questions as I go, does anybody in this group know what their walking speed is? So most people can tell me what their blood pressure is, their heart rate, but what is your walking speed? There's a lot of data that is actually saying your walking speed is your sixth vital sign. So it correlates with a lot of different health measures. But if you don't know and you tell me you want to walk faster, what's your baseline, right? So I have a lot of clients that say, Erica, I'm a little slower. I want to walk faster. But how do you walk faster if you don't even know what your baseline speed is? How do you walk faster, right, is based on how big of a step you take and how many steps you take. So if you're, and how fast you're swinging those legs. So if you don't know how big of a step, how do you also improve that gait speed? How many people in this group actually count how many steps they take a day or a week? I just met with a neurologist recently, and I asked him if there was one measure that you can have from your clients, what would it be? And he said, possibly daily step count, because I want people walking more. Okay, so are we monitoring if someone says I'm walking more? How do we know how you're walking more? Is it maybe you don't take your daily step, but you say, okay, I walk to the library, or I walk to this cafe every day, or I walk my dog every day? And then I want you to think about how does your walking feel? Does it feel automatic? Do you feel like it's challenging? Is it effortful? And we're going to talk about those words a little bit more as you start thinking about your walking. So walking, as I said, is a person's way of walking is an indicator of your human health. I'm not going to read each of these. You can see this right now on the screen, but there are all different studies that go on that talk about how you can decrease your risk for all these different aspects, from dementia to falls to mortality, if you walk more. So originally the 10,000 steps was an arbitrary number. Then all these studies looked at say, well, is there a magic number? So around 7,000 steps is kind of where a lot of the studies said where you can decrease these risks, but of course more is better than less. All right. And if I tell everyone, even if you did one more step that week than you did last week, you're making a positive change. So know where your baseline is, what's limiting you to walk that we can help you walk more so that you can decrease this risk for everything else. So walking, if you look at walking, we use different sensory systems. So a lot of people think of just strength, but we use our eyes. So if you think of your eyes are telling you where to go, right? So you see an obstacle, you're able to scan your environment where you're walking. Then we use our inner ear. So our inner ear isn't just for hearing, it actually helps us right ourselves to gravity. So if we are walking down a hill, right, are we following the angle of the hill, or does our body and our head stay vertical, right? And our body, the rest of our legs will adapt to that angle. And then we use proprioception, or what somatosensory system that is actually giving us awareness of where our leg is in space. So, do you know if you were stepping across a stepping stone? I live in Colorado. Would your leg be able to step to that next stepping stone, or would you are unsure of how big of a step or where your leg is in space? Do you need to look down to be able to know where your foot is? Once those systems all work, they go to the brain, and the brain integrates all those receptors that are telling us that information to be able to give us that motor command to walk. So this happens automatically. We don't have to think of all of this, but when it's not working properly, then we need to augment that. And we're talking about how do we bypass when things aren't working efficiently 100%, because some of those systems can be down to get us to be able to walk easier. So there's three ways to assess walking. So as I said before, if you want your walking to improve, you need to know, well, what do you want to improve to be able to develop a plan, right? So if somebody's blood pressure, right? If you don't know that your blood pressure is high, how do you make a plan for that? First, we need to be aware of what do we need to work on. So the first is capacity. How much can you do? Do you need help from a caregiver to be able to assist you? But also looking at your endurance, like how much can you walk? Do you get tired after walking a block? Can you walk 3 blocks? And there's different tests that I'm going to explain that NUSHU uses that we can actually measure to see what happens to your walking as you're walking more distances. So first is your capacity, then is your quality, right? So maybe you can walk 6 minutes, but at the end, your quality really starts falling apart, right? You start taking shorter steps, your foot starts catching more. All of that's going to increase your risk for falls. But first, we need to understand what's happening. So if your quality of walking is changing with time, which parameters are changing and how do we address that? And then last, I think is the most important is our performance. We can improve our endurance, we can improve our quality of walking, but if that doesn't get us to do what the things that we love, then does that really matter, right? So the main part, and sometimes there's not always a correlation, right? We want your capacity as a physical therapist. I'm helping build people's strength, building their awareness of their foot position, but I want them to be able to go travel, go with their family to a soccer game, to see their kids or their grandchildren, to be able to walk their dog. What is important to us that walking then helps us participate in our daily lives? So when we look at that participation or that performance that I just talked about, it's not just about capacity. So we do need to take in consideration other aspects. So this was from a study actually for stroke rehab, but I really love the idea of that personal factor, right? So I have a gentleman who's doing so much better. He's actually using the shoes, he's improving his capacity, taking bigger steps. But he wants to be able to walk to this cafe that he used to be able to walk to, but he doesn't have anybody to walk with. So he wants to be able to walk with somebody. So if you don't have that support, how do you have that walking to go? So then that would be something that we would have to develop a plan to say, do you have a walking buddy? Maybe it's your motivation. Once you get going, I know for myself, for the gym, sometimes it's hard for me to get there, but once I'm there, I'm all in, right? So how do we get that motivation to actually increase that walking? What is your mood that day? But then also all the environmental factors. So I have one lady who walks great outside, but when it's windy here in Denver, she said, nope, Erica, I'm not taking a walk with you today. So the wind is the one factor that we have to improve her walking capacity that despite any type of weather, she feels confident and comfortable. So each of you might have these different factors. I lived in New York City. Another one was somebody who had a traffic, he can go a street, but an avenue is a lot further in New York. So when he had to cross an avenue, that was worrisome that was his speed fast enough to be able to cross that street safely. So each of these factors should be a goal that we can personalize a good walking plan for you. So each of us have a unique signature in our gait, right? So we talk about our stride or velocity. When you were marching, right, what was your comfortable pace? Were you symmetrical left and right? Was one leg going higher? Was one leg going faster? What was your rhythm? Were you able to adapt a rhythm? Can you go a little faster if you had to go answer the door, right? Can you go a little slower if somebody's walking in front of you, slower at the airport? Are you able to make these adaptations with your rhythm? And what happens to each of these factors? So each of us is unique with certain diseases or diagnoses like Parkinson's that can change some of these movements, medication timing, fatigue. There's a lot of different other factors that can change this signature. But the good news is we can improve it too. So that's what we're going to talk about. So for Parkinson's, this might seem familiar. A lot of patients complain about the shuffling of gait. They take smaller steps. There's decreased foot clearance. Some people have freezing of gait, so that might be feeling like their feet are glued to the floor, or they also might have what they say is festination. Their feet, they get almost glued, but like this stuttering, a lot of little steps. Your foot might catch that you're afraid that you're going to trip. They might have a hard time starting walking. You might just be slower or decreased stability during turns. It might be turns only in narrow spaces versus open spaces, difficulty with dual tasks. But you see how each of you might have a unique walking that you want to improve. The more that we figure out what you want to improve, then we can be able to customize that into an exercise plan for you. One thing that I think is super important is walking can gradually change. So I think I have two children, right? And my one daughter's 13. She looks like a different kid from last year, right? Each day, I don't see those small little changes, right? She's growing each day, but somebody who hasn't seen her in 2 months is like, whoa, she grew so much. The same can happen with our walking. We can have these small little changes that we don't notice. Maybe somebody who hasn't seen us for a while might notice, but if we are tracking these changes, can we see something before they become problems, right? So sometimes I think as a society, we are very reactive. Can we be proactive to say, hey, this is what's happening to my gait when I'm doing X, Y, or Z, right? How do we improve that, right? And the research shows if we target these strategies using cueing, sensory feedback, attentional focus, and task-specific practice, we can do better. All right, we can improve all that. So when I say task-specific practice, if the one thing that you're having a hard time, like I said, that lady's walking outdoors in the wind, we need to practice that, right? She's walking confidently inside. We need to practice and have other ways that we can improve that. If it's doorways, we need to practice that. If it's walking faster and you're walking fine at your comfort pace, I had one lady, she walks completely fine at her comfort pace. All her quality of gait looks great. When she tries to go a little faster, then her foot starts catching. But then that's what we need to be working on. So I like to look at the research and try to follow the practice. And this is one thing that I think NUSHU and Magnes does really well, that we're able to translate the research into what we can use in everyday practice. So there are experts through the Michael J. Fox Foundation that had Gait advisors that said this is what every patient with Parkinson's should be analyzed for walking. So they want somebody to be walking one at their comfort pace, one at their fastest pace, and then also with dual task. But these are the measures they want everyone to look at. What is your gait speed? How big of a step are you taking? What's the symmetry between them? What's your rhythm or your timing of your steps? What's the variability of your steps? That means maybe one step you take, or the first 5 steps you take really well, but then the next step isn't so good. Then you take good steps and then another bad step, right? How consistent or variable are you in your stepping? So this is something now that we used to only be able to do some of these measures in a gait lab, but now with actually having shoes that we can put in different environments, people can actually be measured with these more specific measurements. So I don't know what happened when it just went, it just changed the language there. So sorry for the AI power there. But it's a health wearable, right? So this is the shoe. This company, Magnes, is from Switzerland, that is now coming more and more in the US. And there's sensors. So you basically have a gait lab in your shoe. So as a therapist before, some of the gait measures I was able to do was only in research, or I would able to use like more of my observation skills. Now I'm actually able to measure when you strike your heel on the ground, is your heel here, here? I could say it, it's around this one. It actually is measuring the exact angle every time you step. So this is actually able to measure your stepping and have gait events for every part of your gait. So we'll talk about that. It also tracks your progress in your data. So it's your companion, how many steps you're taking. You can actually record and then send it to your doctor to be able to say, okay, this is I walk well at this time of the day, but not this time of the day, right? Sometimes when we go to a practice, we're walking really well, but that's not your walking in your everyday life. So we're able to capture that in different environments. As I talked before, different environments are very important to see how we're walking. And then the next whole part of my lecture, we're really going to be talking about this vibrotactile feedback. So in the shoes and the heel, they actually provide vibration to help give you more awareness of where your foot is. And we can personalize that vibration to happen only during swing phase of gait, maybe only every time that you step on your heel. So we'll talk about that a little bit more. So first, it talks about measurement, right? We need to measure what we need to before we develop a plan for you. So this is just an example of measuring. A therapist can then analyze, or a doctor, your data with you and talk to you about how big of a step you're taking, how fast of a step, the balance between left and right, how your heel hits the ground, and then based on that, be able to give you a treatment plan. Another nice part is you see on the right side is we can look over time. So maybe from March to June, we can see, did you improve your walking, after we developed that plan? Or maybe all of a sudden you're walking less. There was like an illness or something that happened. We saw a decline. Can we get you back to where you were? So this is a really nice way to track your progress over time. So again, I tell you, I like to read the research and to look at what the research recommends. So there are studies that are looking at better care starts with better measurement, right? So to actually practice evidence-based care, clinicians need to do a movement analysis and then target that intervention. This helps us understand your walking, be able to tailor your care to your challenges, detect earlier changes like I talked about, and then track over time. But I think this technology is also able to measure in your everyday life, not just the clinic, because we get just a snapshot of to see what you're doing every day. So can we look at this in long term? So these are two different ways. Most physical therapists have what they call clinical practice guidelines. So they have guidelines that they look at all the research to say this research is strong, this research is moderate, right? So they do all different studies to say what actually helps improve people with Parkinson's. So I highlighted in the yellow. So balance training, aerobic training is another one that I didn't highlight, but showing how these shoes actually really are addressing the things that we need to be working on, right? Community programs, so walking with people in the community, task-specific training, gait training, external cueing, balance training, all of this, tons of research how that this actually can improve your walking. So first we measure your movement, identify what we need to be working on, then we target that treatment, provide some cues, right, on how you're going to get better with that movement, which we're going to talk about more, and then track to see how you're doing. And then if it's working or not working, do we go back to measure that movement again to see what can be the best plan for you? So this is kind of what, as a therapist, I'd be looking at. I feel like we need another little break of exercise because I've been talking a lot. So we're going to move again in a moment. But I want you to notice this gentleman is a client of mine. It was okay for me to show this for educational purposes. This was during COVID and in your environment, right? So he sent me this video. So this is why I think this is important to know in someone's environment versus a task, we can start making these plans to see how we can improve that. So I don't know how many people here tell me that they have a hard time when they get up from the table and they're trying to turn. How is your walking? So I want you to kind of just watch this gentleman, and you'll see the second time he goes a little bit faster. And I want you to notice his first and second step. And then I want you to think about when you get out of a chair, how that happens. And if you had more awareness of your foot position, would that increase your safety? Did his foot there. Did anyone notice what he did there? This is where I wish I could see all of you. And I made my husband do it because I was just curious. I was like, how else do people move out of their chair? So I want you to look at this next picture. All right. And do you see how he's crossing his leg over there? Right? When we have a crossover step, and this is supported in the research, we have decreased stability, which makes sense, right? And we have a higher risk for falls. But if you're not even aware of what you're doing, of your foot position, how do we improve that? Right? So he was telling me that every time he got out of his chair from the dinner table and went to the kitchen to go get something quick, his family would get nervous that he was going to fall. And his more concern was he hated his family all like getting nervous about it more than he felt. So this was something that we worked on. So I want everyone to just for a moment, so one thing I do with the shoes, and we're going to talk more and more, is you can do vibration when I'm swinging my leg, right? So if I lift my leg and put it down quick, that is a very quick step. So that if I stood up here and my next step, do you see how that would be crossing over, right? Versus if I had more awareness and more range, so it depends, right? We'd have to make sure that you have range in your hips to be able to bring that leg out more. So if you want, just kind of bring your leg out and bring it back. You might even want to put your hand on your knee. And if it's quick, this would be like you would have a buzz in your heel that would be buzz and back, or it would be buzz and back, right? So you would get this vibration to have this more awareness of where your foot is. So then when you take this next step, you have more room here versus that crossover step. Do you see how that awareness piece, and that is one thing that feedback gives us, is that proprioceptive feedback that sometimes we're not aware of where our leg is in space, and this is giving us more awareness to help us with our stepping and our turns. So here's another example. This lady also told me every time I go to the kitchen, I feel like I'm falling into the kitchen almost, right? And the same, when I did a video, this first one, I saw her do the step over. We worked on increasing that step and being able to do that. This is not for everybody, so don't everyone think that this is for you. These are just giving you examples of how you analyze a task, see what you need, and then give the right feedback to be able to personalize that to improve that movement. So what kind of cues, feedback, and instructions can help your walking? I want you to start thinking about, how do you improve your walking? Maybe if you did a sport, my daughter's a really into soccer right now, right? So she's always telling me what her coach says and what makes a difference and what doesn't. So I want you to kind of think about what helps you make those better movements for walking. Because if you want to improve your walking, you want to get the right feedback, right? So do you like auditory feedback? So I want you to think of, well, what is auditory feedback, right? You might use a metronome. You might even start clapping and get that beat. It could be a verbal cue, someone screaming at you, right? Someone saying, hey, go, go, what to be able to do that movement. Do you use a mirror? Do you have visual feedback? Do you look at your foot? You're using your eyes to give that feedback. And then there's tactile feedback. Is somebody tapping you, for it? Is someone touching you and showing you that movement? Or now that we have technology, are you getting this vibration in your shoe? There's other ways to be able to get that. So I also think it's important, just I look at motor learning and how we improve. Do you use analogies? Right? Does someone tell you to pull your ears to the ceiling? You have the string pulling you up for posture, reaching for the stars. There's one article that talked about a basketball player, right? I'm not a basketball player, so sorry to anybody in the audience that is, I might be saying this wrong, but right, you're supposed to get your wrist when you're shooting to go for a basketball. For me, if I was about to go shoot a basketball and I'm like, wait, where's my wrist? I already got pushed, right? And I lost the ball. So we need to have something. Analogies actually help us quicker to get into that. So they said, pretend that you're putting your hand in a cookie jar, and that actually somebody responded better than their hand. So when we're thinking of our body all the time, sometimes to connect that with an analogy, that helps. And I actually connect that vibration with an analogy to even get that augmented part of our brain, so that we really become more automatic with our movements. What motivates you? Video replays. Think about professional athletes, teams, right? We should look at even though for everyday life, let's take some of the sports psychology and sports science into our own movement patterns. So I'll use my daughter as an example. When she was trying to learn how to point her toes better to kick the ball. She would get the video and say, "Oh, look, my toes went up, or my toes were down." She was now able to, she wasn't aware when she kept kicking until he showed her that video and then showed her when he did it right so that we have that. So is a video something that makes a difference? So if we use feedback, right, we want to learn from our mistakes. We want to really understand and problem solve what errors are we making and how can we correct that, right? We're becoming aware of movements that we weren't even aware that were happening, right? So if sometimes we don't even know that we need that feedback, we don't know that our leg is in the wrong position and that's what's causing us to have that crossover step, right? So once we become more aware, then we can make those differences. And then once we have that feedback, it tells our brain how to make that new movement. And then it will motivate us because we want to keep getting that right feedback, right? We want to get that result. So as I said before, we need to first analyze the task or what movement we're doing so we can give you the right feedback. I don't know if anybody listens to NPR. So this is when everything clicks. It was a really good podcast because they talked about you can't give the feedback unless you know the task, right? So if I don't understand gait and can't analyze gait, how can I tell you what phase of gait or what part of your walking needs to be improved? So we really need to understand that to be able to give you. If I didn't know soccer, I didn't know that you needed to point your toe. How can I give my daughter the right feedback to be able to shoot harder or to get that better shot, right? So we need the right feedback to be able to improve, or the right task to be able to improve that feedback. So the picture before, right, there could be this interruption in your proprioception. You might not be able to know where your foot is, but all these external cues improve that internal timing, improve that proprioceptive awareness, where's that foot, and improves that attention and engages your attention to these new movement patterns that you may want. So right now, you might even be familiar with some of the cueing that's used in rehab, right? There's the U-step walker. Somebody might have like a laser light that they're trying to step over. Visual feedback is really good for acquisition of a skill, right? So you're learning, you didn't know you're doing this movement, but then the carryover sometimes it varies in the research. So once you don't have those lines, do you start stepping small again, right? Do you need those lines all the time? How do we fade that? Auditory feedback, right? That would be like a metronome. Hey, I want you to step to that beat. You have music. If you exercise to music, does that change how you move? Lots of research on this. The last is this somatosensory feedback. So in the past, as a therapist, I used to do some tapping and things like that. Now that we have technology with vibration, we can really look at a lot more options to look at the somatosensory system. One thing that excites me about vibrotactile cueing over the other two cueing is nobody else knows that you're getting that cue, right? So if you have the auditory cue, I have some patients, it works great, but they need headphones, right? So now they're walking to a cocktail party or hanging out with their family, they can't put the headphones on. Visual feedback, everyone sees the lines, or if you don't have those lines. So here in the shoes, you have a vibration, no one knows that it's happening, and then you can use it in all different environments. I'm not going to go into all of this, but I just wanted to show a few of these. And then if you have questions at the end, there is a lot of research looking at vibration and how it can help with movement. How some of the research, it's different types of vibration that's being used. Some are using it continuously throughout all the phases of gait. Some are looking at only certain phases of gait. So there's definitely different types of research on improving walking. They're still learning a lot. So here's even more studies on looking at enhancing that proprioceptive processing that I talked about, improving gait outcomes, reducing that variability. So we know that it helps. We here at Magnes are doing more studies to understand this because I think that the novelty of being able to have it not just continuous, but at the right phase of gait that person needs, we need to look at more. So these are some studies that are happening right now that Magnes is involved with of looking at the research with the shoes. And this study, they used vibrating socks. They basically said 71% of the participants responded positive to the cueing. but there's not one size fits all, right? Some people did better with closed loop, and I'm going to, in my next slide, explain the differences between this closed and open loop. Some did better with auditory cueing, some did better with tactile cueing. Do you do better with both? Right? Like, so all of this is what we need to figure out. Not one single cue works for everyone. And as a clinician, sometimes one cue works for people when they're on, another cue when they're off, right? This is where you work with a really good clinician to help you get that best plan. But no, it does work. We just have to figure out the right one for you. So understanding what type of cue works best for you and um, what type of delivery do we want it affirmative versus corrective. So I'm going to go over that in a moment. And then considering the person. If you have a fear, if your attention is lost very easily, that's going to change how the therapist is going to cue you. Is it continuous? Like you just have this like vibration all the time? Or is it going to be only every time that your leg swings or every time that your heel strikes, right? We're going to talk about each of these. There is a big study right now in Europe going on called Unite PD that is looking at continuously looking at, we know that there's benefits of cueing. This is article and this picture just came out in the beginning of this year. And they're looking, does different patient characteristics influence cueing efficacy? What is the long-term effect, right? Some studies only look right after you use the cueing. What happens after 6 months? What characteristics influence that compliance, right? So if you're not using it, it's not going to help you, right? And then what's happening at the brain level. So this is a really big study, multi-country study, really trying to understand. We know that cueing helps, so let's be even more specific to personalize that care. So this wheel is something I use as a clinician, and I teach clinicians on how to match that cue based on that deficit, right? So um, if you look at pacing, or when you were looking at that last study that said open loop, right? If I have a metronome and the shoes actually have vibration that could almost like the sound that you're used to, having beep, 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 you're getting this continuous vibration and I can set it at 100 beats per minute. I could set it at 50 beats per minute that you're going to get a vibration in your shoes. The difference with that is it's pacing you to go, but you don't know if you're matching that pacing, right? You can go faster or slower. And then I can cue, when I say that attentional cue, I can cue every time you strike your heel, I want you to step to the beat. But I can also cue you every time you lift your heel to push off, I want you to step to the beat. You see how that might totally change how you're walking if somebody needs more of a push off versus a heel strike. Um, Versus the novelty also of the NUSHU is performance feedback. So say I set the parameter of this, it would be closed loop. Every time you strike your heel, you're going to get a buzz. Every time you step with a flat foot, you will not get a buzz. So that is based on your performance so that you're going to want to keep getting that buzz. So there's different ways that we can do that for that's open versus closed loop. But we can also do affirmative versus corrective cues. So I just gave an example of positive feedback. You're getting that affirmative cue every time you take a good step. But I also can set and change the parameters in the shoes to say, I call it says corrective, but I call it reminder. So maybe I set that every time you take a big step, right, you don't feel anything. You have no vibration. But if you take a small step, it's going to vibrate and remind you to take a big step the next step. So do you see how that would be a reminder versus affirmative? So there's different ways to work and improve that cueing. That attentional, we can cue step size, we can cue weight shift, we can cue, unloading that leg to be able to take that step. So there's different aspects that we're looking at that then can go directly to that client. So first, we're going to measure your walking in real time. This is your gait signature that we talked about. And then it's a gentle vibration. Some people are like not really sure what it feels like, but it's almost like a little, like when your cell phone vibrates to tell you got a call, that's what you're feeling in your feet. And that's going to reinforce where that leg is to have that confidence step depending on what we're doing. So again, I said you can do that positive feedback when you take a good step. So you land on your heel, you take a bigger step, whatever we set as a parameter, your brain recognizes, yes, that's the step we want. good job. It's like a little pat. So you don't have to have your wife or your spouse to say, take a bigger step, right? It's every time you take that good step, you feel that vibration, and then that's a new pathway, right? Um, so one thing that I do tell people is I'm going to use an example because I'm in Colorado and do a lot of hiking. So think about if you're on a hiking trail, right? There's this one common that everybody goes on, right? It's super smooth. That's the hiking trail. Then there's this other hiking trail that's maybe not as many people go, but that's the destination you want to get to, like, right? That's the pretty view at the end, right? That you want to get to, the waterfall or whatever. To get to that new one, right? It might be a little bit more attention to it. So if you every time you take that heel strike and it's reminding to you you're going down this new path, we're making new pathways in our brain. But if you ignore that and say, hey, it's okay, I just took a bad step, right, we're going to go down that more common path that we keep going on. So we want to change this new pathway, and the shoes and this feedback is saying, hey, this is a good step versus this is a step we don't want. We want to keep reinforcing this new way of walking because we want this new pathway to be our common pathway. We want this smoother. Does that, I hopefully that makes sense. If there's questions on that, let me know. Um, so this is the opposite. When you feel, we can say when your step is smaller than the goal that we set, right, or shorter than that target, or you landed on your toes, not your heels, you'll get a reminder. So you would just set that differently. I would say most people want positive feedback versus that reminder, right? I think of my kids, they don't want me to tell them, hey, I'm reminding you to do this, right? They want to be rewarded for a good step. But there are some people who respond differently. So I think we do need to be open to do two different ways. All right, so we're going to end with just a few quick exercises. So one of the modes for the vibration is called the crescendo mode. So this as you have a stronger buzz, right, you actually feel the vibration intensity more. You feel it stronger in your feet. When you move slow, you don't feel it as much. When you move fast, you feel a stronger intensity. Okay. So I want you to think of this vibration as like your fuel meter, right? We want to keep it up high. So this would be somebody who, even in sitting, right? If I was sitting or standing with a therapist and just moving, you can move your feet. I want you kind of like you're stepping in all directions. So we might just start stepping forward. That would be level one, and stepping back. But what happens when you go faster, and harder? How does that, then you're going to feel more of that intensity of that vibration. But once you start going slower, you don't feel it as much. It's going to give you that feedback to step faster. So this is just one example that we would use in an exercise to try to keep that intensity up and see how fast you're moving. And then once you're doing really well, of course, then you need that next layer. So all my patients sometimes tell me, Erica, I don't want to tell you almost what I'm doing. This is too easy because I know you're going to challenge me again. But this is how we change our brain, right? We want to keep challenging you. So once you get that and you're like, okay, I'm keeping this meter, I'm getting fast movements. Now we're going to do all directions. Now we're going to do reactive. I'm going to call what direction you have to do. Do you see how we keep adding these different layers to continue to have that improvement? So that would be one example. Another example is this joint position sense, right? We want to be able to strike our step with our heel. So if I stepped, we were talking about that turning. So if I was standing here and my first step, I think you can see my video is really small right now. But if I took my first step and I stepped on my heel, that is different than when you step with your toe and then you feel like you're almost falling forward. So one example would be, this would be the analogy. Think of a stamp. If I made a stamp and it was light, right? You don't really get a good imprint. If I didn't get the exactly where I want on that stamp, you might not also get that imprint. So I want you to think of your heel as a stamp, and we're trying to get passports in different are stamped in different countries. So if you just start going forward, right? This might be north. We might be going to Canada. And if you step flat with a flat foot, you're not going to feel that vibration. So the cue that you know that you took a good step is that you're feeling that vibration in your heel. If you don't load your heel and you are really light, right, that loading and how much we're putting weight through it is also our somatosensory system. So it's the position of our joint, but also how much weight we're putting into that joint also. So this would be one other way that we can be working on And then that same thing, we're going to start getting awareness of that other layer. So maybe you're fine when you're going forward, but when you start going faster, then you start stepping with a flat foot versus a heel strike, or maybe when you start adding a dual task. So now every time you step north, you have to name a city in that country. So if you go around that extra layer, does that change your quality of movement? So maybe, and I see this a lot, the quality of movement changes with dual tasks, but then you don't have any reminder to get back to that movement, right? We want that movement to be good no matter what kind of dual task that you're adding. So that would be another example. Excuse me. The other example is looking at biomechanics. So if I'm realizing how much I move when I talk. It's so hard for me to sit here as a webinar. So if we were doing squats, right? And I did this with the PT school last week. If I was doing a squat like this, well, do you think this is going to help me get stronger? Or do you think it's going to hurt my knees after a while? Right? So how many times sometimes we're doing a movement and maybe our knees are hurting or we're not doing the biomechanics and the efficient movement of it. So this is another cue a therapist can provide that I want you to shift back to your heels because we want to activate all those posterior muscles in our body, our butt muscles, our hamstrings, our back muscles, right? To improve posture for mechanics. So I want you to feel that buzz and then bend your knees versus having all your weight forward onto your knees. So you're decreasing some of those forces, but you might not even know where the weight distribution is on your foot. So this is increasing awareness so then when you're doing that squat, you're getting the most out of that exercise. So here is an example of somebody who is using the shoes for freezing of gait. So I kind of gave an example of just general gait. But this gentleman had a really hard time with, you could see there's two chairs. He's going to do like a figure 8 walking. So here's an example of a really strong responder who was able to walk better walking with the shoes. So I'm going to show you his video. Just put his flat there, small step, right? And it gets stuck in his wall very much. And then this is just showing some of his data. So this is the data of that gentleman. So we were able to look in the green is no stimulation. So you could see he took his stride, and that's him taking his right leg and then another step. How big of a step he's taking was 0.56 meters or 0.59 for his right, and it went above to 1.14, which is within the norm. So he improved, you could see in the video his stride length, but we were able to then measure each of those. So looking how fast he's taking a step, looking at the angle, you saw that he was at, basically 6 and 9 degrees at heel strike. That was his mean, his average when he was stepping versus it went up to 16 and then almost 11. So all of this we can actually collect while somebody's walking to be able to see those differences and then see which measures we want to continue to try to improve. So right now, this is well established, especially in Switzerland and other countries in Europe. It is expanding here in the US. Tons of steps analyzed, patient assessments, and one of my roles is really to help clinicians and the patients be able to utilize this more from walking to exercises and to look at that clinical aspect of it. So thank you. I hope this was helpful. Here's my contact information. There's also the website that you can check out if there's any questions. We will be there at your Neuro Challenge expo at the end of the month. So if anybody's interested in trying or seeing me there, that one of the co-founders will also be there with me. So I hope to meet some people in person. So let me know if there's any other questions or things I can help out with.
Thank you very much. Let's leave this slide up for just a little bit in case anybody wants to take a screenshot or write this information down. And well, first of all, this was extremely packed with data and analytics and all kinds of things, which I wouldn't expect anything different from you. You're a researcher. So I'm so glad that we're recording this webinar today because I think people are going to want to go back and review and watch it again. There were a few slides, even I was like, oh, I want to go back and really study that slide, had a lot of really good information. So thank you for sharing all of this research, all of this data. It's so important that we are looking at different technology and different ways to help people with their gait and with walking. So I'm going to share a few of just, I don't know, my takeaways. But before I do that, I'd like to encourage people in the audience to go ahead now into the Q&A bubble that's at the bottom of your Zoom screen and type your questions in if you have any for Erica today. I'm sure you have questions. And again, if you do that, we can answer them. And then again, just to reiterate that they will be at the annual Parkinson's Expo, which is March 28th. Even though this is being recorded and will live on YouTube, it's March 28th, 2026, which is our expo that they are coming to this year. And so can you tell us a little bit about what to expect at your table? Because are people going to actually be able to maybe test a shoe, try one on, see how it feels, the weight of it, all that?
Yes, so be bringing shoes. So definitely people can try them out and see if it, depending on how many, it's going to be more just time of how long we have with each person, of course, but definitely to be able to feel them, to see aspects of all of that, we will be there. And then being able to set you up with other people. A goal is to have these more centers where people can try and have more time. So we're meeting with other people in Florida. So if you have a clinic that you would want it to be at that clinic so you have more time, it would be great just for us to connect with them and be able to train them to have that.
Yeah, that's great. I'm looking forward to it. First of all, I really like how you started off the whole thing with these positive affirmations, the I can, I will. Let's see, I can, I will. Oh gosh, I can, I will. Oh, I must, right.
Yep, there you
Uh,
go.
And I love that because I think these positive affirmations are really important for getting us in the right mindset, right? Because so many times I will talk with people with Parkinson's, at support groups and things and educational events that we are at. And I'll encourage them to maybe, come try something new, a new exercise class that we're offering or a new program. And I hear it in their voice sometimes, and it's the I can't kind of feeling, right? Comes out like, oh, I can't, I don't know if I can. I can't do that. And I love that you do this I can, I will, because I think that really has to be, your mantra, when you're trying to improve your gait or trying to improve anything, maybe any part of your physical abilities. I think that having a mantra like that really sets the mindset. Do you
Yeah,
agree?
I agree 100%. And I think also, I didn't talk of this on the talk, but I think knowing a lot of people are thinking of how they don't want to walk. Like that's what they're thinking. I don't want to shuffle. I don't want to do this. I don't want you, right? And actually, he was a Swiss, another Swiss guy that I went to a course maybe 20 years ago, and he was a professional dancer. And he said the choreographer kept saying, "You look like a banana. Stop looking like a banana." And he's like, "All I can think of is a banana. So all I'm thinking of is this arch, right?" So if you're like, "I hope I don't want to be shuffling. I don't want to be like," your brain is thinking of that movement. So he was like, "What do you want me to look like? Like a carrot? Like what is that image?" So I think also, it's really important before you start any training to think of how you want to move, what you want to move. That positive image is lighting up in your brain. There's tons of research on this, like mental imagery of what you're thinking of. So the
Yes.
same thing with that vibration. If you're thinking of, I want this longer step, you're already thinking of that in your head versus I hope I don't take small steps. So I think that whole positive setting you up for success, you need to look at the whole picture. So I agree with that whole mantra, but then even taking it to that next level.
Right. And I think you hear people saying things like, I don't want to fall or I'm afraid to fall. And the word fall is just so much in their brain that, it's almost like you're going to fall. Stop saying fall. Stop thinking about falling. Let's just say I'm strong. I'm going to stand upright. Yeah. So I like that. I like that you use those positive affirmations. I also like that you really emphasize for people to notice the small changes that you may be having in your posture or your gait or your speed or any of those things, because the small changes, like you said, we just don't pay attention to that because it's our daily life. But sometimes it's those small changes that really add up and then can end up being a bigger problem. So, could you talk a little bit about like what's an example of a small change that most of us might not even think about, but it can really affect the gait, especially for somebody with Parkinson's?
So I think it's the speed would be one, right? So you know that you're maybe moving slower, but you don't realize over time you're moving slower and slower.
Mm,
So if you're like walking outside, and there's actually, I'm a complete study nerd, so I do read all this research. There is a study that actually looked at somebody, they're still putting effort in. So I think if you're putting effort in and you're walking outside, but you're not monitoring how fast you're walking or how far you're walking, then you're just walking over time. You're actually walking less and less. And each
yeah.
time you realize I put 20 minutes in there, but I'm not walking as far as I used to, or I'm not walking as much. So if you're able to say how hard you're working, and even people monitoring their, if you're looking at aerobic exercise, looking at your heart rate, the more we start understanding, then we know that you're in that zone of where you need to be. But over small little changes, you're just going to walk slower and you might not realize that now my speed is less than it was, even though I was practicing, you were practicing walking slow then.
Yes. Okay, that's true. It makes sense. I like the fact that you also stress the importance of, getting that baseline assessment so that people really do understand what their current capacity is, and then what they want to be performing at. And I think that sometimes we just forget that we all have like a vision and a dream of what our quality of life should be. And when you get a diagnosis with Parkinson's, that might change a little bit. The quality of life should still be the goal, but I think getting that baseline assessment so you know whether you're just below, a little above, you're on point. So those are very important. That's a good takeaway. I really like that. And then can you just give an example of the like cognitive dual task while walking? I mean, a lot of us do this, right? Because either we have learned it along the way that we need to be doing something else besides just walking so that we're working our, building new pathways. But can you give an example to the audience of what would be a simple one to take with them today? What's something they can just implement right away without a therapist?
Yeah. So I think things that you might notice that you do already, right? So I'm thinking of a client in my class who, as we walked out of the class, he was talking to me about his weekend and his walking changed. So thinking if you're walking with someone and you're talking or you're listening, those are two different dual tasks that might change. So are you paying attention to your walking and then talking a little bit, then stop talking and paying attention to your walking and then walk again? So what happens when you're walking? Maybe you don't recognize it. So, that's where I was saying the shoes would all of a sudden you would feel the vibration not happening anymore when you start talking, your walking changed. Or ask a spouse to say, hey, when I'm talking to you, do you notice that I go slower? Are you able, can you keep up that pace with your partner who you're talking to? Do all of a sudden they have to slow up for you because now you're moving slower as you talk? So that would be one of more like a motor, they do counting backwards. I tell people to try to think about what you do in your everyday life. So for me, my dual task might be, what do I need to make for groceries, right? What do I have to like? So I'm going to list all different groceries that I need to go shopping. Does that change that movement? Versus a dual task of carrying something that's going to be different, like right from walking to the kitchen and carrying a plate, how does that change your movement quality? So I think there's different types of dual task and practicing that to see, but making sure you're safe before you add on those layers for it.
So it might be easier for somebody just to start with a cognitive dual task while walking, and then maybe talk with their therapist about adding any physical dual tasks.
Yeah, I
I
think that
like
would be
that. Um, I do have some questions about the shoes. I'm going to check the Q&A bubble. Oh, I don't see any questions. Come on now. I thought for sure we'd get a bunch of questions. A lot of times it's just that if you have so much information, which you do, you really covered a lot of, probably answered a lot of their questions. But for sure, if you have questions and you're not putting them in the Q&A bubble and you maybe think you want to ask me later, you can always email Neuro Challenge at the info at neurochallenge.org, and I'm sure that I can get you the answers from Erica. So if you're late to getting questions in, um, a couple of shoe questions. So the buzz that's on the bottom of the shoe, is it inside the shoe? Is it like on, like, are they feeling it on the bottom of their skin, like skin of the sole of their foot, or is it more like the whole foot feels it? I'm just curious, where is it, like on the in the shoe?
so it's actually in the sole. Like you can't see there's sensors, right? So it's you're not going to see it. It's you're going to feel it through the shoe in your heel. That's where you'll feel it because that's where the sensor is. But you can't see them. It looks like a normal sneaker. It's just that's where you're going to feel the vibration.
Oh, and do the shoes have like a charger? I mean, how does that
Yep.
keep?
So I actually have one right here, so I can show you. Um, So just like your cell phone, you would have like this would be your charger. So you would plug this in, and then the shoe where the sensor is then goes and rests right on the that part, and it charges just like your cell phone. You basically have two cell phones in your shoes, that are analyzing all this data and giving you the sensory. So this would charge it, and then you shake them, wake it up, and then you're good to go.
Oh, okay, incredible. Um, and then let me see can the feedback, whether it's a reminder or an affirmative feedback, can that be controlled? Is that always controlled by the action of the person wearing the shoe, or can it ever be controlled by, say, a therapist? Like if they were doing therapy, is the therapist able to control those feedback buttons, or
Yeah,
help me understand that?
so the therapist actually has like an on their phone has an app that they actually, and then the patient also can have that. So usually the therapist would meet with the client and set up a program. So saying these are the settings that work best for you, and then set that up. So if the patient is using it at home, so some therapists use it with their clients in therapy for a while as an adjunct, and then the patient gets one for home, or some just use it in therapy. So there's two different ways that people would be using them, but you would be in your app set up all the different modes, and then that client then knows for home that would be the mode that worked the best for them, so they would be able to change that. So there's all different like settings in here that you would be able to actually see. So when we're there at the expo, definitely stop by. We could show you all the different settings, all the different
Yeah.
tests. It's super simple. If you were doing like a timed up and go test that therapists know that you do, you just literally press that button and slide it to go, and then it's already testing all that data during that test. So
Wow. It's incredible. This kind of technology is just so exciting. And so when somebody gets this information, they wear the shoes for a period of time, they do some walking, they're collecting this data, and then they can share it with their therapist, and their therapist can say, "Oh, this we need to improve our goals here, or we need to work, excuse me, work on goals here, or make this improvement over there." Right? That's
yeah,
the
so
intention, right?
that's it. The intention is the therapist might just do the test in the clinic with them with the shoes if they want to see them doing it, or the patient then would send it to the therapist to say, okay, this is what we would be looking at.
Good, good. We do have one question. Let's see what we got here. Somebody asks, how long does the charge last? I think you might have answered it, but go ahead and answer again.
And Chinook, tell me if I'm wrong with this one, but it should last all day, like 8 hours for someone walking. So when you put them on and then you would charge them again overnight, would that be correct?
Yeah, it's almost around 8 hours. It depends if you really walk 8 hours long, then maybe not. But when you sit down, they will go to sleep to save battery life. When you stand up and start walking, they wake up and they will provide you the feedback again, like the vibration. So yeah, we say 6 to 8 hours. They should definitely work.
Okay. All right. Thank you. Well, what I'm going to do is because we are over 1 o'clock and I want to respect everybody's time here, we can end this webinar now. But what I'd like to just encourage everybody to do is go check our YouTube channel in a few days if you want to revisit this, because there was so much information on the slides. And if you didn't get your question into the Q&A bubble to get answered, we're happy to answer those questions later. And then, of course, they will be at the Expo 2026. So come on down to that and make sure you give them, see what the shoes are all about. It's very cool technology. So thank you, Erica. Thank you, Chinook. This was a really great webinar. I'm so pleased that we were able to get this information.
Thank you. Thanks for having us.
Yeah. Take care, and I'll see you in a week or so.
Yes, exactly. All right. See you
Okay.
soon.
Bye bye.
Bye.
Yeah. Bye-bye.
Bye.